the Nurses on Boards 101 presentation. We will then hear from a panel of experienced nurse leaders who will be introduced as they address the audience, so stay tuned. And after the panel, we will have a live question and answer session, as I had mentioned earlier, from the audience. And as stated earlier, please hold your questions until this time, and please submit them through the chat box so that we can field them smoothly. Once again, thank you for joining us, and I am pleased to turn the presentation over now to Kimberly Harper.
Thank you so much, Jenny. I appreciate the opportunity to share some of this afternoon with all of you. Obviously, this is something that I have a strong passion for, something that I enjoy spending a great deal of my spare time, if there is anything like that any of us have, with another couple full-time jobs. It's wonderful to have the opportunity to really be a spokesperson for something that I feel so strongly about, and one of those is clearly the nurse's role in governance and serving on boards. So if we could change the slide to the next one, please. We'd like to talk a little bit about framing this conversation. And in framing the conversation, we'll go to the next slide, which really talks a little bit about where we're coming from here. And this is a quote that I love to share. And it's a quote from Dr. John Lumpkin, who is chair of the Robert Wood Johnson University Hospital Board of Trustees. And he said once, "Some questions have no good answer. One such question is why the participation of nurses on hospital and healthcare agency governing boards is the exception rather than the rule." Do you guys agree with him? I can tell you that I certainly do. And I think many of us need to do everything we can to change that. The truth is that nurses bring a very unique and special set of skills to the table. We bring leadership, quality, process improvement, communications, human resources, strategic planning, finance, teamwork, and I bet each of you could name a dozen others. So one might ask, why nurses? Many believe that all boards benefit from the unique perspective of nurses to achieve the goals of improved health and efficient and effective healthcare systems at the local, state, and national level. And I can most certainly tell you that I can be counted among them. This is something that many of us feel strongly about and want to do everything we can to change. I'm sure that most of you are familiar with this book, right? Anybody on this call that hasn't seen this book has probably been hiding under a rock for the last 5 years. The book, The Future of Nursing and Leading Change, Advancing Health, was published early in 2011 by what was formerly called the Institute of Medicine. It's since been renamed the National Academies of Science, Engineering, and Medicine. And we all know this book outlines the full recommendations for what nursing and all of healthcare actually should do to achieve a higher quality health outcome for our nation. One of the important recommendations was recommendation number 7. And that was to prepare and enable nurses to lead change to advance health. And the detail of that recommendation included these quotes, that nurses, nursing education programs, and nursing associations should prepare the nursing workforce to assume leadership positions across all levels. Public, private, and governmental healthcare decision makers should ensure that leadership positions are available to and filled by nurses. And nurses who should serve actively on advisory committees, commissions, and boards where policy decisions are made to advance health systems to improve health care. Notice in this, there are actually 2 parts, especially in this first one, the first quote. The role of nursing in preparing ourselves and our profession is one part, and the second part is the role of decision makers to accept the unique value that nurses bring to the decision-making table. Both of these are very, very important, and we cannot be successful without achieving both. As nurses prepare to serve in these important decision-making roles on boards, it's important that we recognize that in the knowledge and skills needed by board members, board competencies actually equal nurse competencies. They're literally the same. What they seem to be looking for as they're asked and surveyed seem to be the qualities that we as nurse leaders bring to the table. You see the words on this screen, and obviously strategic orientation, organizational awareness, systems thinking, these are the things that we do every day. And if we look at the bottom one, advocacy, who of us is not an expert in providing advocacy for those that we serve? These are the skills that are requested of board members. Do we not have these skills? I think we do. The American Hospital Association Center for Healthcare Governance and Health Research, and Educational Trust created a list of knowledge, skills, and personal competencies that were needed. Though this was in 2009, this was published, it really has not changed, has it? All of these are skills that we, as nurse leaders, possess. Yet, nurses are still often overlooked for high-level board seats. Why is this? Clearly, this has created quite a challenge for our nursing profession. However, one of the many positive results was a call to action. And this call to action is something that has been very, very exciting to be a part of since its inception. In April of 2014, organizations were invited by the Future of Nursing Campaign for Action, which is funded by the Robert Wood Johnson Foundation and administered through AARP, to attend a meeting in DC where this concept was discussed. I'm sure that many of you know Drs. Sue Hass-Miller and Susan Reinhart, who led this effort. Wonderful nurse leaders who have absolutely championed this work. As the president of the National Forum of State Nursing Workforce Centers at the time, I was included in this group and have been involved ever since. At this initial meeting, the concept was tossed out to see, would organizations at the national level for nursing have any interest in joining together to collaborate on this topic and this initiative? And if so, how might that work? So the first meeting was held in April of 14, and then in July of 14, the group met for the second time and began working out what would a coalition such as this look like. At this meeting, a steering committee was formed, which is a smaller group of the larger group. And that steering committee came together in October of that year and met to draft a strategy outline. And then in November of 2014, that steering committee came back to the full group, reported back, a vote was taken, and all of those nursing organizations formed the National Nurses on Boards Coalition. Thanks to the leadership of the Campaign for Action and all the strong nursing leaders who joined the effort on this national initiative, the work has been amazing and so heartwarming to be a part of all of that. The original Nurses on Boards Coalition organizations included those that are listed on this slide. Since that time, 10 additional national nursing organizations have joined and actively participate in the coalition. Great people doing great work. Our goal is simple, but it's often not easy. The mission of the Nurses on Boards Coalition is to improve the health of communities and the nation through the service of nurses on boards. And as a leader of this coalition, I can assure you that every single thing we do is done with this goal in mind. One key strategy that we have has always been to look at measurement and a measurement tool of achieving our goal of improved health through the placement and voice of 10,000 nurses in board seats all across America by 2020. So if you hear the word 10,000 nurses on boards by 2020, that's what we mean. Our goal is not so much the number, it's the work that comes out of that. And we believe in order to be effective, we're going to need at least 10,000 board seats filled by nurses. And we continue to work in that area. The Nurses on Boards Coalition is made up of work groups. We're all volunteers. There is actually an executive director. His name is Lori Benson, and we have an administrative coordinator. His name is Patty Epstein. And they're the only full-time employees of the Nurses on Boards Coalition. The rest of the board members and officers are all volunteers. And in the work that we do, the work is focused around specific work group areas. And you'll see on the screen now, these are the things that we're really focused on at this point: creating and sustaining a transformative growth organization. We want to continue to grow. We want to continue to be innovative. We want to continue to have the voice of nursing heard at the table where healthcare decisions are made. Facilitating board placements is something that takes a village. You know, finding the spots and getting the nurses into those placements is not an easy task. Targeting and cultivating key board positions is something that a group is working diligently on. Providing resources for education, preparation, and support that we'll talk a little bit more about in a few minutes. Leveraging synergies with members and partners. Aligning strategies and implementation at the national as well as state levels. It was very clear to us pretty early on that we could do all this great work at the national level, but if we didn't have grassroots efforts like your organizations working on this, we were never going to be successful. So we created an absolute cross-the-country strategy where we have contacts for every single state that are working on this initiative with us. We also need to facilitate communications and public relations and have lots of information that's shared on a regular basis. Hopefully many of you receive our emails because you're in our database and are part of this work. Managing membership recruitment, engagement, and retention. As organizations continue to join us, and they do, national nursing organizations continue to step up and say, we want to be a part of this work. We weren't included in the original invitation, but we really believe in this, we support the work, we support the effort, and we want to be involved. And so we continue to bring in new members at every meeting. Demonstrating and measuring the impact that nurses serving on boards makes. And that's a tough one. You know, I will say that of all of our challenges, measuring the impact is the hardest. You know, we all have these wonderful anecdotal stories that we can tell of the nurse who got appointed to a board and then these wonderful things happen. And it changes the culture of health for the organization or the stakeholders that are involved in that work. However, that's difficult to account for in some kind of a written documentation. Obviously, how many nurses are serving on boards is a lot easier than the work that's done and the outcomes. We continue to work on that, and we have had a great deal of assistance from the Robert Wood Johnson Foundation, who are experts at measurement in community health issues, and so we will continue to do that. As you can see on the next slide, we have our work cut out for us. However, there's no doubt that the strength and the commitment needed to be successful in our efforts lies within us. Currently, we now have 26 national member organizations, and as I said, that continues to grow. We also have founding strategic partners and sponsors and implementation groups on state strategies all across all 50 of our states. So it's a tremendous effort by a lot of people to really bring this home. And so if we look at our progress on the next slide, the progress is pretty exciting. In fact, I have to tell you that we're going to show the website here in a few minutes. And when I created this PowerPoint presentation and sent it a little over a week ago, I think it was sent, I checked back to make sure that the number was the most updated. And when I sent it, it was 3,346. Yesterday, I came back on our website to look at the number, and it was 3,356. Today, earlier today, and it might have changed when we look at it in a few minutes, it was 3,369. So you can see that the nurses that are involved in this work and have committed to entering their information into the database, either as a nurse who currently serves on a board or a nurse who wants to serve on a board, continues to grow. These numbers are great. We're very excited about it, but we can't stop here. You know, it's more than the numbers. It's what's really happening with this work. So you might be asking at this point in time, how do I find the right spot for me? So in doing so, we would suggest that you consider the following. One is start with an open mind. You know, do you really want to do this? Is this something you have a passion for? You know, we believe you can bring so much to the table, but you have to believe that as well. So going into it with an open mind of, yes, I have a little bit of time or a lot of time or a medium amount of time that I can share with an organization in board service, is the beginning step. The next one is kind of understanding your mission. You know, board service should be rewarding and positive, or you're in the wrong spot. So selecting an organization that's close to your heart, that's something that you have a passion for. I mean, none of us wants to give an extra few hours a week to something that we're not really interested in, or we feel is an ineffective board that's not making a difference. We all want our work to make a difference. So finding the right thing that fits our mission and our values is an important step. And performing an assessment of what kind of board interests you. What are you looking at? What is it? A healthcare board? Is it a philanthropy board? Philanthropic organization? Is it your kids' soccer team, the board that oversees the community soccer field? What is the board that really strikes your interest? Perhaps for you, if you're seasoned, you might be ready for a hospital board or some Fortune 500 company that's going to pay you money to serve on their board. Lots of different opportunities at all levels for all of us. And once you've found one that you really think you might be interested in, then really performing a deep dive on that organization, finding everything you can on the website, in the paperwork that's out there, looking at if they're a 501c3, going online, finding out how their money's used, where their money comes from. All of that's something that you're going to want to do before you actually jump in feet first. Preparing your bio is the next big step. Everybody that's interested in this needs a one-page bio. Now, I don't know about you guys, but my CV is like 19 pages. That's not what a board wants. We've got to put that information, the important pieces of looking at what their board is interested in and how can we bring value to that board, putting all of that in a one-page document. Contacting the organization or organizations, which if there are more than one that interests you, is the next step usually. Talking with them, do they have board seats open? What are the expectations of their board members? Do you have to pay money if you serve on that board, i.e. give a donation? Mostly philanthropic boards expect that people will either get or give X amount of dollars for that organization's budget. For many 501c3s, the expectation is that people will, and as you especially will start looking for grants or grant monies, people will want to be able to report that all of their board members, or 95% of their board members, or whatever that X is, donate personally to the organization. Registering with the Nurses on Boards Coalition is another important step, and we're going to talk a lot about that in a minute. But this will allow your state contacts to help you if you are looking for something. We have all of this database that's been submitted to us, and it's all divided up by state. And if you allow us to share your information and to contact you, then your information is given to the contacts in your state. And many of the states are doing some pretty creative things about working with organizations to find out what governing boards are out there that are looking for people and trying to make matches. Reporting on your board position once you get one is important for us. And then I would just really want to remind everybody to never, ever underestimate your value and the value that you bring to a board. They should want you because you bring so much value to their decision-making process that probably is not there today. Another one of the many, many resources for people who are interested in this is the website for the Nurses on Boards Coalition. And that's the screen that you see right now. We're going to jump into this website, and its address is nursesonboardscoalition.org, and you see that at the top there after the HTTPS. And Jenny's going to kind of drive us around here a little bit as I kind of talk through this. The first page of the website obviously starts out with our mission, and you've heard that from me before, to improve the health of communities in the nation. That's what it's all about. And so we've just redone this website. It's a new website. It's not our original one. And we did it with the input of many individuals, many of you perhaps, were involved in the creation of this new website to make it easier, make it more user-friendly, very easy to find resources, and very easy to be counted. So if we scroll down this first page, we see here that we have two big buttons, Finding Resources and Finding a Nurse. The Finding Resources button we'll go into in a second, which will take us to areas that we can do. And then the Find a Nurse is for the opposite audience. We have resources for people who are nurses who either do serve or want to serve. And then we also have resources for organizations that are looking for a nurse. So again, we have two audiences that we serve with this. If we scroll down the page a little bit more, we'll see a thermometer. And that thermometer is changing all the time. As I told you, it changed today from one number to a different number. So it's always updating as people continue to submit their data. It's my hope that by 5 o'clock or 6 o'clock tonight that number will have gone up again, because some of you will have gone into that database and submitted your data. So a lot of it is the ability to get involved. And if you do that, if you look down just a little bit more, the do you serve, you've got two options here. You know, one is yes, I do serve and I'd like to be counted. If you click on that button, it will take you to informational fields that we'll be asking of you. And a lot of that is demographic data. It's who you are, where you live, what boards do you serve on. One of the important pieces of that is the tenure that you have agreed to serve on that board. If you don't have an end date, it will require you to have an end date. If you don't have an end date, just put one out into the future how long you think you'll be on that board. If there's not a specific, if you weren't voted in for a 2-year term of office or whatever that might be. And then complete all that data. Then once you've done that, there's a real important question is, you know, do you want us to be in contact with you? And we hope that you will say yes, because in doing so, that will allow you to receive updates from the National Nurses on Boards Coalition, and it will also allow you to receive information from your state activities that are going on with your Action Coalition or your organization of nurse leaders or whatever organized effort in your state is doing that work. The other button option there is, no, I don't serve, but I want to serve. And so that's really important as well. If you don't serve on a board today, but you'd like to, please tell us that, because we're always looking for people to serve. That information also, you know, will be shared with your state folks. And there's, when you get into, there's also an option of I serve now, but I want to serve on another one, because people sometimes want to serve on more than one board. So that will be an option as well. So if we go back up to the top, let's click on Find Resources on that tab. And if we do that, it will take us into a lot of the resources that are available. And we'll just ask Jenny to kind of scroll down that page for us. And it shows you articles that are out there. We have resources that are available to people, that you can find articles, you can find webinars, you can find blogs. You know, if you all give us permission, we'll put this webinar up there. Any information about preparing yourself to serve on a board or getting yourself extra education if you already do serve on a board, anything that's related to that we are aware of, we add to this website. It's constantly changing, I can tell you, always changing. It's always being added to. So keep your eye on it, go back to it often. And again, I would point out that this is the for nurses. Now, Jenny, if you click on the for organizations, you'll see it's a whole different set of resources. And these would be for organizations that might be looking for a nurse. And so this is how they let us know that they're looking for nurses. And when this information comes back to the Nurses on Boards Coalition, it is shared with the member organizations and or the state contacts, depending upon what the request is and what that board looks like. So you can see there's a great deal of information that's there. Also, if you flip up to the top, you see that the member section is there. If we look at the upper level navigation, you can see who the members of the Nurses on Boards organization is. And again, reminding everybody that the members are organizations, they're not people. So members being AARP, the American Association of Critical Care Nurses, ANA, AONE, American Nurses Foundation. You're seeing all of them on the screen. It's the organizations that are members. And so through that information trickles down to state level chapters and affiliates in most instances. Also, you can see that we have partners, and the partner group is different than the members. Partners are people who sponsor us or provide us assistance in some way. Most of those are financial, which is great. I mean, obviously this work can't be done alone. It takes money. And so the ability is there for organizations to sponsor at many, many levels. and they can be large organizations that give, as you can see, as much as $250,000, or they can be smaller organizations. Some of those, towards the bottom, we have the Founding Healthcare Leadership Organization Strategic Partners, and these are organizations that choose to say, we support the mission. And so for a hospital or a school of nursing, you have the ability to go in and say you want to be a sponsor, and then you can become a sponsor for whatever the rate is, depending upon how many organized affiliates that you have within your organization. If you have questions about this, I'm more than glad to answer anything. You know, we are, again, always looking for additional supporters, people who want to get involved in our work at whatever level that is. So you might think now that you would be ready to ask a question, how can I participate, if you might want to participate? So I think we've talked about a number of ways that you can do that. And one of those, obviously, is to go into the website. And if you haven't already done that, I would encourage you to do that, to sign up on the website and either be counted if you already serve, or let us know that you'd like to serve. We are always glad to help in any way that we can. You know, we hope you'll follow us on social media. If there's a question that you have, we're always glad to answer any questions that you have, or to direct you to those that have the answers. You know, I'll be the first to say, I'm the chair-elect of the board of directors of the Nurses on Boards Coalition. I don't have all the answers. You know, Marla Weston is the chair of the board. Marla would tell you she doesn't have all the answers. You know, none of us do, but together we're finding the answers. And they continue to revolve around the fact that we need more people to get involved, because it's with every single one of us that a change is made. And I think we all want our work to be valued. We want our work to make a difference, right? So to quote Susan Hassmiller of the Robert Wood Johnson Foundation, she said once, and I think she said this many times, board service can be rewarding to both nurses, both personally and professionally. It not only requires them to exercise leadership, it expands those skills and advances their capabilities and knowledge. It gives nurses the chance to meet people and enhance their professional networks, and it can be inspirational and empowering. And the most important part of that is it truly makes a difference in the healthcare that's being provided across our communities. So won't you join us in creating healthier communities? I hope that you will. In summary of our discussion today, we hope that you have a deeper understanding of the Nurses on Boards Coalition, the skills and attributes that it takes to serve on a board and to be in a governance role, and that you'll personally commit to doing your part, whatever that part might look like. It may be very different for each one of us, but doing your part to help carry this important work forward. We at the Nurses on Boards Coalition truly believe that our communities and our nation are counting on us. And that's all of us, not just a few of us. So if you have questions, we've left you with any questions, please feel free to contact me directly. You're welcome to email me or call me, or you can write your questions or comments to us in the chat box, and we'll answer those at the end of the webinar during our Q&A. So on behalf of the entire Nurses on Boards Board of Directors, thank you for helping us to improve the health of our nation. This is a photograph of our Board of Directors. The next slide. And they're all committed individuals, highly committed individuals. These are people who are presidents of national nursing organizations, or who are staff members of national nursing organizations, who have very, very busy lives and busy jobs, but they dedicate a tremendous amount of work to this effort on your behalf and on behalf of all of the patients and the people in our communities that we serve. So we hope you'll choose to join us in this effort. And if we can help you anytime along the way, I hope you'll let us know. Thank you so much.
Great. Thank you, Kim, for your very thorough presentation. We will now hear from 4 highly experienced nurse leaders. I will pose questions to the group about the service of nurses on board positions, and request insight on how to be the most effective leader. My first question is, why is it important for nurses to be on boards?
Should I just jump in here? This is Lisa Bond-Holland. I am currently the Director of Corporate Governance for AmeriHealth Caritas. I've been doing corporate governance work for about 10 years, formerly with a large health system where I managed 23 people on the board, and I'm currently at a private company where I manage currently about 12 different boards. One of the reasons why I think it's important for nurses to serve on boards is to, as Kim mentioned, just to echo what she said, to further advance our ability to improve health by having, taking part in setting the strategic direction of an organization. Very often as nurse leaders, we are very involved in the operations of our organizations, of health systems, but this gives us the opportunity to have a seat at the table and actually set the direction of the organization and have more input. Very often decisions are made by those individuals that may not have any clinical background. At times they may have clinical background, but don't have the vast view that nurses have. And so it gives us an opportunity to have a seat at the table when we're setting strategic directions of our organization. Also to echo what Kim said, nurses are the best advocates. We often give voice to those who the organization serves and to further the mission of the organization. So I think it's imperative that nurses have the opportunity to serve on boards and offer up all of the hard skills and soft skills that Kim in her presentation.
I guess that means that's me. Hi, I'm Betty Long, and I'm calling from Philadelphia, Pennsylvania. I've been a nurse for 31 years, the last 14 of which I have been busy as the president and CEO of Guardian Nurses Healthcare Advocates, which is a patient advocacy business serving patients and families throughout the United States. In 2003, when I started Guardian Nurses, it was just me. And now 14 years later, my team is at 20, and we continue to grow as companies and health and welfare funds look for unique solutions to help their employees and members through our healthcare system. I have participated personally on many community and professional boards in the last 20 years. Currently, I serve on the Nightingale Awards of Pennsylvania board and also the Montgomery County Behavioral Health and Developmental Disabilities Board. Like my colleagues before me, it is critical for nurses, obviously, to be on boards, particularly non-nursing related boards, because I think we bring a unique perspective to the table, and it's important for the public and other community members to hear that perspective. Time and time again, every year, nurses are voted the most trusted profession. So I think that it's time we leveraged that trust to make a greater impact in our communities.
Awesome, thank you. My next question is, how did you prepare for your leadership positions?
Valerie, you may be on mute.
Hello? Can you hear me?
Yes.
Okay, can everybody hear me?
Yes.
Okay, so as I was saying, I'm the current president of Philadelphia chapter of the National Association of Hispanic Nurses. And how I prepared for my leadership position, I think it was stated in the earlier presentation, I identified an organization that I wanted to be a part of, that I felt passionate about. And I started doing some research and joined that organization. But as far as leadership itself, I mean, I just sat and listened, and I had various ideas, and I wanted to provide input, and I decided that signing up and being part of the board, that was going to be my ability to influence change with the team. So that's what I did I started with one organization, a community organization early on, and then as I became a nurse, I signed up for the Hispanic Nursing Association, the Philadelphia chapter, and then on a national level where I served as the treasurer for 2 terms. And I feel like being part of that has helped me develop my leadership skills, has offered me the opportunity to work and become part of different networks and have different resources, and established me as a leader amongst my peers as well as in my community.
Great, thank you. My next question is, how did you manage your professional time with regards to your positions, nursing career, and leadership commitments?
Hi, this is Holly Lorenz. I am the Chief Nurse Exec for UPMC, and in that role, I have oversight for our Center for Nursing Excellence, over 30 different hospitals, and we have over 15,000 nurses. I am also an Associate Dean at the University of Pittsburgh School of Nursing and our strategic leader for our 4 schools of nursing. I have an opportunity to be on a number of boards, and am excited about this webinar, but as it relates to work-life balance, I believe it's really important to obviously work very hard, but also set aside time for yourself to play hard. And I am not always the best person at that, but I think what's really important is planning for how you put in balance into your life. I have to make a very conscious effort to let people know the evenings that I limit myself to from a work or a volunteer perspective. I think one of the things that keeps me very grounded is I always have a trip planned in the future. It's almost like I can't get off a vacation unless I know when my next vacation is going to be, even if that's several months down. And I think family remains a priority regardless of where you are in raising a family. I've been a nurse for over 35 years, and I think my family's actually become more important over the course of that time frame. I also think it's really important to know when you're most productive and to use that time to make sure that you're focused on work and set that time aside, not just set time aside in your own mind, but block that out on your calendar so that other people aren't scheduling you for events during the time that you're really, really productive and creative. I also think it's easier to take time for yourself if you've got a strong team. If you feel comfortable of having people manage initiatives without them having to come to you for decision-making or responses along the way, and allowing people to demonstrate your trust in them in doing so. One of the things I have found very helpful for me is that I do a lot of closing up of projects, and I block several hours out every Friday afternoon that is for unresolved issues that can actually be a meeting, or unresolved issues that I need to handle, so that I've got a project that's tied up with a bow before I walk out of the building on a Friday afternoon. I think managing your own calendar and being incredibly organized is very, very important with that as well. And letting people know that you're always available. And I actually give my cell phone to everyone, because I think that way people reach out for you instantaneously, and it really allows you to move through issues more rapidly.
Great, thank you. Now I'd like to ask, what kind of responsibilities would I have as a nurse on a board?
So I think along with bringing your competencies and skills that you have as a nurse leader to a board, generally all board members have certain responsibilities and certain duties, those being the fiduciary duties of the board. the duty of care, the duty of loyalty, and the duty of obedience. The duty of care means that a board member has to actively participate and attend all board meetings. You have to make sure that you're educated with regard to the industry or the organization for which you're serving. The duty of loyalty requires the board member to operate in the best interest of the organization, especially if it's a nonprofit, and make sure that whatever actions you're taking are not for personal gain. And there's also the duty of obedience, which requires a board member to be knowledgeable about state and federal laws and regulations that apply to the organization for which they're serving. So making sure you have a deep understanding so that you can set that strategic direction that I mentioned earlier and act in the best interest of the organization.
Lisa, this is Betty. That was great. Spoken like a good lawyer. I like the fiduciary. Let's make sure you underline that. So in terms of my perspective, I think just participate, right? Be interested, volunteer for subcommittees, offer to help out at events, speak up at meetings, because believe it or not, you do bring a unique perspective that as a nurse, nobody in the room may have. Show your commitment, be someone with whom you would want to work. And finally, and as Lisa mentioned, be clear with what, if any, financial and time commitment is expected of a board member, before you decide to say yes. And whenever I'm invited to be on a board, I typically say, what is it that you're looking for? Because I don't want to commit to something if I can't honor that. So just be clear up front, what is it that you're expecting of me, so that so that you don't disappoint them and you don't feel bad about not being able to meet your expectations. So that's it for me.
Thank you for your insight. My next question is, what surprised you about serving on a board?
So this is Betty Long. I think two things. Despite members being typically, recruited and personally vetted, their commitment to the organization may not be as passionate as yours. Folks will not show up to meetings or events, and you can't let it get to you. You just do your best and honor your commitment. And two, bureaucracy can and does exist even in a small nonprofit organization. And for someone like me who does not like bureaucracy, that can be troubling. So that's it for me.
Hi, this is Valerie Caraballo. I agree with everything Betty said, which were some of my comments as well. But in a different respect, I did gain, I have and I continue to gain a lot of invaluable knowledge and leadership skills in working with a dynamic team, because not all boards are that way, but I have also encountered those as well. But you gain a lot of insight in working on boards, so it's still rewarding to be able to be on a board.
This is Holly. I would echo some pieces of that as well, Valerie. I think one of the things that has surprised me so much is how much I really enjoy giving back. I talk a lot in different settings about the legacy I leave, and I believe serving on boards is another way to leave that legacy. It also gives me an opportunity to network professionally, but with a different set of professionals. Some of my boards are healthcare centric, and many are maybe related, and then some are not at all related to healthcare. So it gives me exposure to different professionals that are active within our community. And so I have another group of people that I interact with socially, but it also gives me a better sense of our own community, what some of the issues are that I might be completely unaware of if I was just having that vision and perspective through my day job. Seeing things through different eyes has been very helpful for me, and it's actually forced me to be influential in a very different way with a different group of people, and probably build some other skill set for me that maybe I would not have needed to use if I was still working within that comfort level of, my employer and my own healthcare setting. I think one of the things that has been particularly interesting to me is I've had the opportunity to do a lot of participate in board education as we've entered into a pretty aggressive capital fundraising campaign for some new buildings in one of my boards, and it's actually a very different perspective than it is in what you think of from a capital perspective of being a nurse and things like that. So it has really helped me from many different personal standpoints as well.
Great, thank you. My last question is, what advice would you give to a nurse that is new to a leadership position?
All right. I guess I'll take this one. This is Valerie. So to a leadership position or choosing to be on a board, I think definitely do your research, find out more about the position that you want to enter as far as leadership or on a board, and know that it's going to take commitment. You should be passionate about, which was mentioned before, about the position that you're taking, because you want to be committed and to that position. So be committed. Know that it's going to be hard work. So again, you want to balance your time and look at the time that you have available to dedicate to that position, and know that you're going to, your input is valuable. And your insight is valuable, and you're going to reap a lot of benefit, and it's really rewarding to be part of something more than just your nursing role. I think the leadership position is very rewarding.
And this is Holly. I would echo that as well and add a couple of things. I think it's really important, particularly as you're new on a board, is find a mentor on that board. Find someone that can help you navigate through topics or discussions or decisions that might be unfamiliar or uncomfortable with you. If it's a board that takes you out of your traditional sphere of influence, figure out how you learn more or how you stay contemporary with the issues that are being discussed at the board, and surround yourself in a board with colleagues that you can learn from. I mean, as much as you are giving your time and a certain level of commitment, I think it's important to realize that there are things that you can take away from being a leader on a board, and leverage and complement your strengths with that board. I would also say it's incredibly important not just to be present and committed to your board, but also be able to speak up when you have something to say, whether that's in agreement or suggesting a different direction for the board, or one of the things that I think it's hardest for the boards that I'm on, when you're in executive session, that's when the tough questions have to occur. And I have been on a board this last year that has had tremendous issues that I never thought we would have to discuss from a board perspective, and it really does take someone with some courage to bring up some of these issues and have a conversation that people in the same room may not agree with you. I think that's part of your responsibility of being a board member, is to be that advocate. And I would certainly learn some of the landmines that might be in your future on a board, but also learn what roles each of the key stakeholders on the board play.
Holly, I'd like to add to that. I think it's important for when you're in a new role to find out what the onboarding process is when you're interested in a board, and to ask if you could have a mentor if they don't offer it, to help with that transition process. And I do agree that you will be required to give voice and to challenge the status quo as a board member. Very often now, many boards actually evaluate their board members and do 360s, and there are a lot of competencies similar to what is done on the management side of the house.
Yes, that's excellent examples and points.
Great, thank you all for your insight. So in just a moment, our speakers will respond to the questions that have been posed in the chat box. But before we do, we can celebrate nurse leadership by bringing to light the spirit of the fearless leader, Florence Nightingale. So that is a picture of two modern-day fearless leaders, Betty Long and Barbara Wadsworth, immediate past president of Ponal, senior vice president of patient services, and the chief nursing officer of Mainline Health, who many of you may recognize.
I see the resemblance.
So now we will go through the questions in the chat box, and Allison will assist us in doing so.
Hi, Jennifer. Actually, as of right now, there are no questions in the chat box. If anyone does, please go ahead and put that in there, and we can wait just a second. Okay, Jennifer, there are no questions.
Okay, so one question I would like to ask the audience is who is looking to join a board? And if you could explain why you're interested, that would be great. You can also use this as an opportunity for any of the speakers to add any additional insight.
This is Holly. One of the additional comments that I would add, as I suspect several of the people that are on the call are, contemplating, is the time right for me, or how do I jump in? I just had someone actually this morning to me ask how they could get on a board, and I think it's about finding that good fit, as we talked about, but also asking someone else to maybe broker that role for you. It is I think the ability for us to serve on boards with our backgrounds as it relates to community health or being on a nonprofit board, but bringing in the voice of healthcare is incredibly important. And I think that getting to that position is often easier if you have someone else that's navigating that with and for you.
Holly, this is Lisa. To add to that, I think it's very important that we give voice to what our desires are. So if we are very interested in serving on a board in a particular area, every opportunity to network and let people know that you're interested in serving on the board serves well. And generally, it's been my experience that once you serve on one board, the invitations generally come once you have that experience. But in the very beginning, it's helpful to get on smaller nonprofits. And again, just network and letting your network know that you're interested in serving on a board is also very helpful to getting on a board.
Okay, thank you. So I can begin to wrap up our webinar. For any questions that did not have the opportunity to be addressed during the session, please connect with us. You can reach me at my email provided here, and I'll direct your questions appropriately. And we would love to have you join our networks. You can stay in the loop with our work by visiting our website, signing up for our listservs, and following us on social media. Once again, I would like to give a huge thank you to all of our speakers for your insight and your thorough presentations. I'd also like to thank our planning team, Allison McIntosh, Robin Wagner, and Elizabeth Menscher. And thank you to Sarah Hexum, the Executive Director of the Pennsylvania Action Coalition, and Marion Tuck, the Executive Director of the Pennsylvania Organization of Nurse Leaders, for your leadership and direction. And as we had stated earlier, the link for this webinar will be posted soon, and stay tuned for part 2 of the Future of Nursing webinar series. Have a good evening.
Thanks,
everyone.
Jennifer.
Thank you.
Thanks, everyone.